All right, good afternoon, everybody, and welcome to Cattle HQ Live, a webinar series hosted by South Dakota State University Extension. My name is Erin DeHaan, one of the co-hosts for the Cattle HQ Live webinar series. And I'm happy to present to you today Dr. Russ Daly, who is our Extension Veterinarian. We'll be discussing cow and calf health and reproductive vaccinations. As a reminder, if you have any questions throughout the presentation, please go ahead and type them either into the chat or our Q&A feature, and we'll address those questions at the end. But without further ado, I'll turn things over to Russ and let him present to you about our cow and calf health. So take it away, Russ.
All right, thanks for having me on. So, yeah, what I want to talk to you about today, and we can have a discussion about some of these issues, is basically getting ready for calving season. What we're, see here, there we go. Talking about the different populations of animals we have in our herds, cows and heifers and bulls. I'm going to spend most of my time talking to you about the cows and heifers. Not that the bulls aren't important, but we have a little set of management tools that we use for bulls. I'm going to spend most of my time on reproductive diseases. This is the time of year where we have to start thinking about, like I say, next calving season, not only next calving season, but next breeding season, and getting them ready for what's ahead of them. So I'll spend most of my time on parasites, on reproductive diseases, and talk a little bit more about things like parasites and some calving time health issues if we have time, and hopefully we'll have some good discussions and some questions and answers here at the end here too. So I'm going to get started talking about the reproductive diseases. There's so many things that can affect cow-calf reproduction and the ability of our cows to get bred. And fortunately, most of the time, when bad things happen, we have open cows or late calving cows, that it's not one of these problems. But these are examples of problems that can be very profound. If we have they oftentimes will tend to occur in outbreaks, and we'll have many animals affected at once. So that these all bear keeping track of and doing something about them, and at least controlling what we can control about them. Every single one of these germs or these diseases on the list here can affect reproduction in a lot of various ways. So all the way from ovarian dysfunction and the heat cycle disruptions, all the way to pregnancy loss and what we call in cattle abortions, in miscarriages. And that's a very dramatic and kind of devastating thing after we've spent all that time getting that cow bred, that heifer bred, and put all those resources into having that pregnancy, and losing that at a late stage is really can be kind of frustrating. So I talk to audiences all the time about how do we manage and how do we prevent these diseases. I a lot of times will talk a lot about biosecurity, keeping these diseases out of a farm if we haven't had them in our operation. It's hard to keep some of these out because they're very associated with animals that we bring in. Controlling environment and stress, especially in our where we're at here in South Dakota with the harsh winters and muddy springs that we have. Controlling as much as we can control our animals' exposure to those elements. But I'm going to talk probably primarily about vaccination here. That is something that we do have under our control as far as controlling these infectious reproductive diseases. All of these ones in red here on the list would be things that we do have vaccines available for. I want to talk in a little bit more detail about them and what we know about them and what they're labeled for, and how we can make some choices about which ones to use and the timing of those vaccines. So here's that same list of diseases. that we worry about, infectious reproductive diseases in cow-calf herds. For some of them, we don't really have much of a choice. For Neospora and Trick, we really don't have vaccines that are preventative. There are vaccines against trichomoniasis out there, but they really don't prevent infection. If you use them in an infected herd, you might be able to have some cows hang on to some pregnancies a little bit more likely, and so it's not really a preventative measure. But for these, we certainly do, and for a couple of them, we don't really have much choice as far as what type of vaccines to use because they're only available in killed fashion. So these are bacterial diseases for which killed vaccines are what we have. But for others, and these are two very important infectious reproductive diseases. We do have choices. We can use modified live vaccines and we can use killed vaccines. And I'm not going to get into a lot of detail about what each one of these diseases cause, but just know that all the way throughout from fertilization, from even before fertilization, from the estrus cycle all the way to calving, these viruses can have a role to play in decreasing our reproductive efficiency. And I will just say the names of those two diseases or viruses sound like they wouldn't have anything to do with reproduction. BVD is probably much more important on a reproductive basis than it is with causing diarrhea. And in the same way with IBR, it does have a role. It's the same virus that causes red nose and pneumonia in cattle, but its function is probably much more important when it comes to reproduction than some of those other effects. So those are really important diseases to worry about. And so we do have vaccines. We have choices of our vaccines, and I'll just use some typical vaccines that we would be exposed to or that we'd be marketed to as far as what products we could be using in our animals. So I'll give you the typical pre-breeding vaccine, and many of you are used to using these on a very regular basis. I do want to say too, when I put up pictures of vaccines, they're more for illustration purposes. I'm not endorsing that anyone's better than the other. And in fact, I'm kind of the opposite when it comes to that. I really think, within the world of modified live vaccines or within the world of killed vaccines, I think they all probably work about the same. I don't have any real preference for which brand of vaccine that gets used. I really do believe they all are pretty much the same. So using a product that you're familiar with, that your veterinarian is familiar with, I think and if you've had good luck with it, there's really no reason to change. But I do, as we get into this discussion, want to talk a little bit about things we know from research that can help us understand ways to use these maybe in a better fashion. So a typical pre-breeding vaccine for cattle would include those two that I mentioned, the BVD and the IBR, and then lepto and vibrio. And so that's the killed vaccine portion of these vaccines. And all of our modified live vaccines and all of our vaccines period for pre-breeding are also going to contain these antigens. And it's always a little interesting to me why they're in there. They don't cause reproductive problems. They're more associated with respiratory problems. I think the vaccine companies just include them in because that's their core, with these vaccines here, with these antigens, that's their core viral vaccine. So they just use their core viral vaccine in the reproductive vaccines, even though these things really don't have much of a role to play in reproduction at all. They might help, when you think about vaccinating cows, we're boosting their immune system against those germs. Not that the cows themselves are going to have problems with them, but they might be able to increase antibodies in the colostrum. The calves will get, and maybe the calves will benefit from them. But that's just a note there that even though our reproductive vaccines include those antigens, it's really the BVD, IBR, and the leptovibrio that we're really interested in. So that's the typical ones, and these are just a few examples of what you might find at a veterinary clinic when you go to buy your vaccines. All right, so I made the statement that there's a choice of vaccines in a broader sense. I mean, there's lots of choices of brand names and different things, but in a broad sense, you're either going to be using a modified live vaccine or a killed vaccine. And I'm specifically talking about the IBR portion and the BVD portion of those vaccines. That by nature, the lepto and vibrio are killed. So we don't really, that's not a part of the decision-making process, I guess. So the dogma, if you will, and you've probably heard this from discussions from vaccine companies and veterinarians over the years, is that our modified live vaccines do provide, the way they work, they provide good protection against viral infections, because the way they work is to get inside body cells, and that's how viruses work too. And so if we stimulate the immune system to be more shifted towards the cell-mediated immunity, which the modified live vaccines do, then we usually have a better protection against those viral infections, those viruses getting inside the cells. So, and I just said, BVD and IBR, they're viruses. So that makes a lot of sense that the modified live vaccines would be really important and really useful for protecting against those infections. Now, modified live vaccines have some pitfalls to know about. And those of you who used vaccines before know that modified live vaccines, they come in a box like this with a glass bottle and a plastic bottle, and you have to rehydrate them. And just know that we have to keep that virus alive until it gets into the animal and starts working. So that means we have a lot of handling things we need to take stock of, including using that vaccine up before it gets too old, after it's mixed up. Saving this for the next day is not going to work, because the virus will be inactivated over time. It dies out. And I always say too that if we mistreat a modified live vaccine, you might think, well, we just made it a killed vaccine. If we left it on the dashboard of the pickup in summertime and inactivated it, well, it's fine because it's just a killed vaccine now. Well, that's not exactly true, because in the modified live vaccine, they put a lot less of the antigen in a dose, because they need a lot less of the antigen in a dose, because it's going to expand once it gets inside the animal. So killed vaccines have more of the antigen per dose, and because when you inject that into an animal, that's all the animal's gonna see. It doesn't expand or grow within the animal. So handling is a big thing, but also safety. And vaccine companies are required to prove that their vaccines are safe for the animals. When we use modified live vaccines, they have to prove that at a much increased dosage of that modified live vaccine, that they don't cause problems. And so usually when vaccine companies are looking at safety, it's, well, the health of that animal itself. Did we cause a fever? Did we cause it to get sick and have a reaction to the vaccine? For reproductive vaccines, they also have to consider the safety to the fetus if we are using these in pregnant animals. And I'm going to discuss that here on the next slide, because it's a live virus. It's weakened, so it's supposedly not going to cause us the problems. But does that necessarily mean it's not going to cause a problem in every animal that we give it to? And so here's a couple examples. Is for pre-breeding vaccines. We know from research, and I've cut out the references here. I can sure provide them to you if you're interested. But if we have a what we call a naive heifer. So a female that's never been vaccinated for BVD or IBR, been exposed to that virus. The first time we give that modified live virus, we know from research that that can cause some problems. That creates problems with the estrous cycle and the ovary function, and that's going to affect that animal's, especially that animal's first breeding cycle, right? With her estrous cycle. So that's even spelled out in, and I've got just some examples from a modified live vaccine label here. In even they say this in their caution statements on the label, is to help ensure safety, heifers must receive at least 2 doses of this vaccine, with the second dose administered at least 30 days pre-breeding. So they're talking about there has to be at least 2 doses of this vaccine given in order for the second dose to not cause a problem. So 1 dose right next to breeding time can cause some ovarian dysfunction. So they even say that on the label. Now, there's also labels on modified live vaccines that say that you can give these during pregnancy to cows. Now, why would you want to do that? We'll talk about that here in a little bit. But say you needed to vaccinate your animals, and the only time you can do it is during pregnancy check or something like that. Here's the here's the warning part of those modified live vaccines is it may be administered to pregnant cattle, provided they are vaccinated with this vaccine again within the past 12 months. So they're saying too, it's really important if we're going to use these modified live vaccines that these animals have seen this vaccine and responded to this vaccine before, so the vaccine we give is not going to be causing any problems. Now, I don't include it on the slide, but historically at SDSU, when we get pregnancy losses, abortion cases into the diagnostic lab from cattle, it is not uncommon to find IBR virus as a cause of that pregnancy loss. And in many cases of that IBR causing pregnancy loss, we can do genomic sequencing on the virus and find that it's actually the vaccine virus that has caused the problem. And so vaccinating pregnant cows with modified live, vaccinating naive animals with modified live vaccines is really something that I'm against. I don't think that's a good use of our modified live vaccines. And the warning labels on these vaccines will even bear that out. So to get into this safety thing a little bit more, now even if you have animals that have been previously vaccinated, we had the question about, well, do these vaccines cause potentially cause problems in normal animals that have always been vaccinated? So we took on a study several years ago in conjunction with North Dakota State, and we wanted to study that question. And we wanted to have numbers enough to see a relatively small difference in pregnancy success, so less than a 10% difference. Now, depending on your size of your herd, a 10%, less than 10% difference might be something that's undetectable or just chalked up to a bull that was a little less than stellar, or weather issues or hot weather during breeding season. So what we really wanted to do is get enough numbers of animals to tease out these little differences. So we ended up finding 1,400 cows in 9 herds over 2 years, and we adjusted for age, and we accounted for age and previous calving date. And these were university herds, but they get managed just like your herds back home. So these had all been previously vaccinated, depending on the herd's own protocols over the years. And so we ended up, some of them got sold because culled from the herd, didn't have anything to do with calving. Ended up with 1,304 animals with data that we could use for calving. So there were three treatments that we randomly assigned the cows within each herd to one of three treatments. We use the modified live, and that's that typical vaccine that I talked about, the viruses plus the Vibrio lepto. And we use the same, the same antigens in a killed version with all those same antigens. And then we gave third of them just salt water and saline. We didn't vaccinate them at all. And we did this according to the label directions. And back then, the labels said either 30 days before breeding or 30 days or 60 days plus 30 days pre-breeding. So we just followed what the vaccine companies were telling us to do. So when we did that and tallied the pregnancy success, we did find some differences between the groups. And so here's for the entire breeding season, the differences in the groups. And so we had the best group came in at 98% of pregnancy success, and the worst group came in at 95.2. And then in the middle was this group that really wasn't different between either one of them. So can you guess what, we had modified live, we had saline, we had killed vaccines. And these were normal cows. They weren't exposed to anything. And over the course of the breeding season, there was a difference. Now, not a whole lot of a difference, right? Because we had the numbers of animals now to make the statistics significant. In your own herd that's maybe less than 1,400 cows, this could be something that's easily just chalked up to something else, like I said before. So there were differences between these groups for the whole breeding season success. So what were the groups here? So and I'll just write here because I didn't have these on my legends here, but the Bovashield is the modified live, and again, we don't really care about which brand or what company and all that it was, but the fact that these were modified live vaccines versus killed vaccines. So it was actually the killed vaccine that showed us the better success pregnancy-wise, and this would be the modified live virus right here. So not a big difference, but it was statistically significant. But what was even more interesting was as you looked at the AI success, so the first service conception rates, there was even a bigger difference between the killed virus and the modified live virus vaccines. So a 2.8% difference in the breeding season in 56-day when we ultrasounded, 56-day pregnancy rates about that. And then the biggest difference was early on. So we made the conclusion that the modified live vaccines, remember I said in naive heifers, the ones that never had vaccinations, we know that messes up that first cycle. In a certain, not every animal, but in a certain percentage of those animals. So what this showed us was even in non-naive heifers and cows that we saw a difference, and that the modified live vaccine was affecting pregnancy rates, especially the early pregnancy rates. And again, these were not exposed to any pathogens or anything like that. These were the normal cows that just were out there doing their thing in our university herds that were managed in a commercial fashion. So back to this. So now we have this idea that modified live vaccine, maybe there's something that's up there. So I want to come back to this slide and talk about our typical pre-breeding vaccines, and now thinking about both of them together, but on the timing of them. So what does the label say about when you should be giving these vaccines in relationship to breeding? So we saw from the last study, we followed the label directions, but maybe we were too close to breeding. Maybe that's what was messing up that first heat cycle and the AI conception rate. So here's an example, and I just pulled some of these randomly off of these reproductive vaccines about timing wise. So here's one that says 14 to 60 days prior to breeding. Here's one that says approximately 1 month prior to breeding, and then followed 2 to 4 weeks later by a dose of the killed vaccine, the killed Vibrio lepto. Another 2 to 4 weeks prior to breeding, 2 doses 2 to 4 weeks apart. So they get there's quite a range there, first of all. And you notice these are all pretty close to the time we would be turning bulls out to pasture or starting our estrus synchronization in our timed AI programs. So the next question was, okay, how does that distance away from breeding time mean anything? So that was the subject of the next study we did, and that was comparing a modified live. Whoops, so I'm sorry, something happened there. um, Comparing the modified live vaccines with the killed vaccine, and this is basically a killed vaccine product here. So for this one, we used cooperator herds, so herds like your own, that we studied the effects of the vaccines that were normally given in these herds. So we had the cooperator herds randomly give some of them modified live and some of them killed vaccines. We couldn't convince the cooperator herds to just give saline, which is, we want to protect these animals somehow. With a university herd, we can get away with some of that other stuff. So we just had the 2 treatments in this case. And so here we were looking at that same question that we did previously, but also some aspects of timing. So here's the killed vaccine again. In this study, we didn't see any difference pregnancy for the whole breeding season in pregnancy rate with the whole breeding season. But here's that other the other indication of the modified live versus the killed in the AI in the early conception rates. And so we know, and Aaron and Julie and our extension people talk in detail about we want to get cows bred quicker, sooner. The sooner the more cows we can and heifers we can have bred in that first heat cycle, the more pounds we're going to be able to wean in the fall. So there's a difference there, can be substantial. So here we, again, in this study, we found the difference between the modified live and the killed vaccine. But here's the other thing that was interesting was that we looked at, now this is just all the vaccines together. So modified live versus killed all together, didn't matter which. Looking at what we call the vaccination interval. So in other words, how close to breeding did you actually give that vaccine? And so these were cooperator herds. They did it according to, they wanted to follow the labels, but they did it according to their own schedules. And sometimes they could, depend on when they can get the animals in, when they can get help and those kind of things. So instead of, on this chart here, instead of the different types of vaccines, you have the different intervals. So the red bar was really close to breeding, 27 to 30 days. And remember, some of those labels now are saying like, 2 weeks, 2 to 4 weeks ahead of time. The yellow was 30 to 37. And then we had some that were given probably what the labels would say, that's too long before breeding. But we saw the success, the pregnancy success to AI, and as well as the breeding season, was better when you were farther away from breeding, whether it was a modified live or a killed vaccine. So even longer intervals between vaccination and breeding than what you would see on the vaccine labels. So even with killed vaccines, there seems to be an effect of giving those vaccines close to breeding time when you would have these, and the immune system responding to the vaccine and possible effects on the heat cycle. And since these studies, we've done more work, and work has continued with Dr. Perry and in his work at Texas A&M with exactly finding out what these are doing to the heat cycle, what these are doing to the ovaries. So there's more detail on subsequent studies, but I wanted to get these bigger picture studies out to you at that time. So along with, the modified live vaccine that we've heard the attributes of modified live vaccines over the years. There's also things we've heard about killed vaccines. And the dogma around killed vaccines is, well, they're good against bacterial infections because they work different. They work different on the immune system, and they promote antibodies. And that's a big part of the immune system, especially for against diseases that bacteria, agents, germs that are floating around the animal system. The antibodies have a role to play in the bloodstream and in the lymph and in the body fluids. So bacterial infections, that's how they work. And that's the benefit to kill vaccines. And now remember, IBR, BVD, they're viruses. So there's some worry that maybe they wouldn't work as well. Now, killed vaccines, they need boosters, right? The first dose probably isn't going to be enough in most cases to be very fully protected against a significant challenge, right? So, but they're safer, we don't have to worry about them causing any disease issues, so to speak, in the animals due to the vaccine. But on the other hand, well, they're safer, but do they actually work, right? So these first two studies that I talked about, we didn't have any challenge. These were good years in which we didn't have the incursion of BVD or IBR, probably because of the way those herds are handled, right? With not bringing in a lot of animals, or when they do bring in animals, using your biosecurity and isolating those new animals so they're not the uh, the ability for new animals to bring something in is lessened in those herds. But what if you did have a problem? What if there was BVD or IBR that presented a big problem? So to answer that question, um, I like to use this study, and it's one of several, but this is something that was done in Auburn several years ago. But they're looking at some of the same issues that we looked at here as far as pregnancy rates, but now they're challenging these animals with the actual germs. So this is an amazing study because it went for so long, and usually we do kind of quick hitting studies, one breeding season kind of thing. And one breeding season, that's a long study in some cases for universities. This was actually two calving seasons. So I'll walk you through here, and they had the same groups that we used in that first study with modified live vaccines and killed vaccines and saline. But what they did here was, and I'll just kind of hit the highlights here. They weaned so they started the project when they weaned heifers um, from the very well early in life, 5 to 7 months is when they started with these heifers. They would vaccinate those heifers with modified live at weaning time, and then again when they would go into the breeding herd. And then from there, they actually vaccinated these animals during pregnancy. They calved them out. They did the same thing again the next calving season. So they're keeping them another calving season, breeding them using the same vaccine groups. But the difference here is they're giving them a BVD exposure. They're running persistently infected calves in the herd of cows. And then later on, they're actually IVing these cows with live IBR virus. So really profound exposures, right? And so now the question is protection. Okay, we got some inklings that first of all, killed vaccines might be better for pregnancy rates, when something's not happening, when the disease isn't happening. And then we're getting this inkling that maybe cows that have been vaccinated during pregnancy and not pre-breeding, or the farther away from breeding time, I should say, is better. So this one covers both of those, but also in addition to a really profound challenge. And so here, they really didn't find any difference between the modified live and the killed vaccines. I mean, there's a numerical difference with this would be the modified live again. And again, I really don't care about the product names and brands and those kind of things, but I'm looking at the killed versus the modified live. We're pretty confident that we could plug any modified live into these studies and any killed vaccine into these studies. So there's really no difference in protection. So that tells us that that dogma about the killed vaccines not working as well maybe isn't correct. That they're still protecting those animals in the face of a really profound challenge. The other thing that's important with this setup here is setting those heifers up with modified live vaccines the very first time. And so making sure that they have a good basis for their immune system with a modified live vaccine in in stimulating that cell-mediated immunity really gives you a lot of flexibility later on to vaccinate these cows even during pregnancy and still have some protection. So that's a really key part of this. The other takeaway is don't vaccinate your cows with saline and think it's going to protect them because they had a lot of abortions in the control group. So where am I going with all of these studies here and this information? I think we do have to understand that modified live reproductive vaccines do have the potential to adversely affect reproduction, even in non-exposed herds. Is the effect large? Probably not, but there is a measurable effect in the research we've done, and that effect is worse early on in the first AI in first breeding cycles. So, but we do know also that the proper preconditioning those heifers, so weaning time at Bang's vaccinating time, getting those modified live vaccines into them. At weaning time for these calves is probably just the viruses, right? The same preconditioning shots that we give animals to protect them going into the feedlot. But then the next one using a modified live reproductive vaccine to get them started on the lepto and vibrio too. But doing that as calves really helps mitigate those effects. And regardless of vaccination time, increasing the time between vaccination and breeding seems to have some benefit as well. So the killed vaccines given during the previous gestation, sorry about that, the previous gestation can be sufficient to protect. So in this situation, we're not giving the the vaccines pre-breeding. We're actually giving them to the pregnant animals in the previous breeding season. So that's something that can be done, and if those animals have been set up in years previous with modified live vaccines, then they tend to then they'll still be protective. And I'm a big advocate of not giving modified live vaccines during pregnancy, just because we do have evidence here, and I didn't present any of that data here, but we do see that once in a while we will see some vaccine-related abortions due to IVR in animals that have been vaccinated. So if you're going to do this this system this thing with giving modified live or giving vaccines during pregnancy, make sure it's a killed vaccine. And you might be actually looking at some of this stuff and saying, hey, this sounds really interesting. This is different than what I'm doing right now. I would really advise you to before making any changes, talk to a veterinarian. They're going to be the ones that know the ins and outs of all these products, the modified live versus the killed, and can give you some input as far as what's happening in your individual herd. So don't go making these changes willy-nilly just because of something I'm saying. Be informed, about the research that's out there, but also talk with your veterinarian about what changes you might be looking at. So I'm going to go through the other things, and then we'll hopefully still have some time for questions at the end here. So that's my spiel about reproductive vaccines, and I do think that's there's some important knowledge to understand about how we're using those things. But I did want to touch on some other things, getting ready for calving season, first of all, and then getting ready for next breeding season. I want to touch on internal parasites just briefly, and help us understand, you know, our animals are picking up these parasites out on pastures. And so very commonly what we'll do is deworm animals coming off of pastures, which makes a lot of sense. You know, we're putting them into winter lots where they're not going to be exposed to parasites as much. So deworming them during the fall is addressing the worm burden in the animal. But I do want to also throw out the thought of strategic deworming, and the fact that we oftentimes will consider deworming animals in the spring to decrease the pasture contamination. This is the life cycle of those worms out on pasture, and so it illustrates the fact that of the whole worm burden that we're talking about on pasture and the animals, only 10% is walking around with the animal, and the rest of it's out on pasture that have been the eggs that have been deposited out in the manure, and the eggs are hatching and they're turning into larvae and they're making themselves available for grazing. If we have a springtime deworming program, that's going to over time decrease pasture contamination, because we're not we're deworming those animals before they have a chance to participate in that cycle, in at least the animal side of things. There's still, excuse me, going to be some worms that emerge from their overwintering. Those larvae will dive down deep into the soil when the frost comes, and then as things warm up, they're going to emerge again. But if we have animals that have been dewormed after that first little bloom and first opportunity for infestation, then we can actually decrease pasture contamination over time. But in the fall, like what we're doing right now or have done probably already, we're looking at taking care of what worms they have picked up on pasture. So treating the calves, I mean, that's for another topic for another day. Really is a good idea for their performance in the feedlot. But cows, when do we want to deworm them? So treating them in the fall to clean them up in preparation for calving. So thinking about their ability to turn nutrients into milk for the calves. And there's some, do we need to do all of the cows, just the poor doing ones, or do you wait until right before calving instead of the fall? Those are questions that are good to consider. But fall deworming is really what we're talking about, to have those cows ready to milk really well and provide some good nutrients to those calves that we want them to grow and thrive in their first few weeks of life. So that's internal parasites. That's just scratching the surface. We could talk a lot more about that in one of these future webinars. One of the things that we'll be hearing about probably in the next few months is people calling up and saying, got all sorts of scratching going on in my herd, lice infestations. And so that's a common thing that we see every winter when it gets cold out. We remember that lice are species specific. Cattle, louse don't affect sheep or other animals, and vice versa. Lice will spend their entire life cycle on the animal, so there's not a component that overwinters in the lots or inside a barn, or for that matter. In winter, it's kind of opposite of what you would think about most biological organisms. When it's cold out, that's when they really take off and accelerate their life cycle. In summer, they don't like the hot weather, so their reproduction slows down. The numbers of those insects aren't as high on the animal themselves. So things really slow down. The lice are still there on those cattle in summer. There's just not enough numbers to really cause any scratching. But in the wintertime, that's when we see it happen. And so there's a a life cycle that takes place every 3 to 4 weeks. One of the things that we worry about is the use of, because most of the time when I get the calls from lice infestations, they're going to be animals that have been treated already, maybe treated this time of year when they're going through the chute at preg checking time, for example, and we'll treat them with a poron, like an ivermectin type, or maybe one of these cleanup products that are the synergized permethrins. We can do injectables that only get the sucking version of the lice. Porons will give both of the versions of the lice, and I think porons are what we see most often. Even the best product that is the longest lasting product doesn't last very long at all. So you look at it as knocking down the lice that are active on that animal when you treat them. So preg check time treating for lice, yeah, you're doing fine with the lice that are on them right then, but typically October, November, there's not a lot of lice on them. So most of our products probably work just fine, but it's the fact that they don't have a very long residual activity and that we give them too early. So delaying that louse treatment until the colder weather when the lice are more active, or maybe even waiting until you start to see the inklings of those animals scratching might be the time to give it. I don't, we do see some instances where we think the lice populations are becoming resistant to some of these products, but I think in the most of our cases, especially given the fact that when we retreat the animals, they improve. I think most of our issue is just the timing of when we give those products and realizing that they're more effective as the lice populations become more active. So that's just a little bit about external parasites. And then the other thing, getting our cows ready for calving season, is in some instances we might want to boost those animals' colostrum, the antibodies in the colostrum, to provide those calves some protection against the scours germ. So scours vaccinations is something that a lot of herds will take advantage of. Sometimes we just reserve that for the heifers and the younger cows. They're the ones that need the most help immune system wise. The older cows have been around the block and their immune systems have responded to a lot of these germs that are normally present in an operation. But we want to think about timing of these vaccines as well. And so 5 to 6 weeks before calving, so it's pretty close to calving, is when they're most effective. And some of these vaccines will have on their label that you could give these at preg check time or months ahead of calving. Even those are still going to be more effective the closer we wait to calving, just because the cow doesn't start pumping those antibodies into the milk, into the colostrum, until relatively soon before calving. So that's the timing issue with that. And when we're giving animals their dose for the first time, these are killed vaccines. We don't have modified live versions of this vaccine. So the killed versions need a booster in order to get the immune system stimulation that the vaccine company has gotten their products approved for. So those last few things really kind of scratching the surface. If you're interested, we can certainly address these in future topics. But that's really what I have for now. And so if we have any questions or have further discussion, we can get into that now.
Yeah, thank you, Russ, for sharing some really great information for folks to consider as they, start preparing for calving season here and wrap up with weaning. But yeah, we'll now go into our discussion portion of the webinar. So if you have any questions, please type those in the Q&A feature or in our chat features, and we will have Russ help you get those questions answered.
Now I'll be mean and ask the first question while we wait to see if anyone puts one in the chat. So this is the question I get, and I know I'm not a veterinarian, but The question is always, what's the threshold? So how many calves should be scratching or cows scratching, or at what stage should I actually treat? Because they know that the lice, to treat for the lice is kind of short-lived. They want to just do it once because they got to run everything through the chute. You know, you've heard this story before. So what's the threshold? Is it 20%? Is it 10%? Is it 50%? I never know the answer, so I'm just
Yeah.
trying to learn.
Well, yeah. And that's the answer to that is our age-old extension answer is that it depends, right? But so there can be some different ways to look at it. I think I would be so if things are happening like already in December, pretty early on in the lice season, it would be a smaller threshold for me to go back in because I know that as the cold weather happens, it's just going to get worse. And then the other factor that I look at too is so that those animals starting to scratch like the end of March, around calving season, if there's not too many of them, I probably would, kind of try to ride it out. Although, cows scratching, during calving season, that's probably not a good thing either. But then the other factor is what's the purpose of what's the goal of the herd? So commercial animals, scratching on fence posts and maybe occasionally probably not as important as if you were a seed stock producer, wanting to sell bulls and heifers and you want them to look good, that would be the other consideration too. And so in those herds, you start to see one or two of them scratching, I'd get in and get it done.
Okay. How about the feedlot? Because, that's a lot of times I'll even get it in the feedlot and they're saying, well, at what point is performance going to be decreased? And I don't know. I haven't found any studies that
No.
tell me that. And so I'm like, well, if you think there's that many, treat, you know what I mean? But I never know what
Yeah.
the right answer is.
That's a really a good question, and we need veterinary entomologists, to do more work on it because there's not too many. When it comes to external parasites and even internal parasites, there's not a whole lot of people doing a lot of this work. I think we know more about flies, than we do lice, and which is probably not much there. Yeah, that's a good question, and I would think, to the time of year too, and how much longer you're going to have the calves, that kind of thing. So early winter, around, mid-December, if you start to see some scratching and they're this fall's calves and you're going to have them, you're feeding them out, yeah, maybe better do something. Whereas if it's March and you got some and they're ready for the truck, maybe we can just let it ride.
Okay, thanks. Okay.
Russ talked about that, having, paying attention, especially to our young females and getting them set up is really important for long-term reproductive success. Do you have just general recommendations then for, as we move our first calf heifers, into the mature herd? Is there anything we need to consider for, any different management on them, in terms of, I know some folks will like to mix them together, but
Mm.
yeah,
Yeah, man,
maybe keeping them separate or.
just plain management wise, not so much the vaccines and that kind of thing. Because for the vaccines, it's almost from what we've been seeing, by the time they've had their first calf, the window's already closed as far as setting them up as a young, and by young I mean weaning time, selection time, bangs vaccination time. That's when we should be using that modified live in them and setting them up. And if we do, we have a lot more flexibility later on. So really nothing different as far as vaccinations go. And you guys probably know more about, how to manage that transition for the first calf heifers into the going up to the adult table, so to speak. I've had clients that have done a really good job of separating out those first calf heifers, and then then the problem group becomes the second calf heifers, as as they are making that transition. So I don't know that I have a really great answer. It's a good topic for extension, make cow-calf management topics. Um, what everything comes down to is how do you gradually manage those transitions, I think rather than bam, here you go, heifers, duke it out with these old bully cows and see how you make out. And I don't, that's really easy for me to say, how do you put it into practice is really a lot tougher.
Nope, I think you hit the nail on the head there with, just that really, getting those replacement heifers set up
Yeah,
with your bangs. That's
so important.
absolutely. But, I think we'll, go ahead and wrap things up here. If anybody has any specific questions, please feel free to reach out to Russ directly. He'd be happy to get those questions answered for you. But be sure to check out the SDSU Extension website for our upcoming Cattle HQ live events. We will have a brief survey that'll be sent out here at the end of the webinar. And we ask you guys to kindly fill out to make sure that we can continue to improve this program and improve our webinar series. But again, thanks for everybody that joined us today. We appreciate you taking the time out of your schedule to listen to Dr. Daly, and we'll see you next time.